Hello everyone, and welcome to the Pure Movement Integrated Health Center website. I'm uploading this video to give you some auditory information related to our informed consent, of which you will be able to sign and review as well as have your own copy after your new patient exam. Informed consent in terms of the chiropractic realm, as well as any healthcare professional, is basically allowing you, the patient, to understand that there are benefits, risks, and alternatives to treatment. The major thing with the benefits for chiropractic care is our goal is to give you a proper evaluation to make sure that we are the right person for you. Myself and Dr. Anna Rentes here at Pure Movement are very integrative in terms of making sure that we are making you the best team possible for your health and your optimum wellness. During your exam, we will discuss this, but if you are trying to get some information prior to your appointment, here's what an informed consent entails. Some of the things that it will be specific is in our office, we do both chiropractic manipulation and dry needling or acupuncture. With chiropractic joint manipulation, one of the biggest and most concerning risks is a cervical neck adjustment that leads to a vertebral artery dissection. And what that means is basically if we're working on the neck and we put too much torsion on it, and you have other comorbidities prior to the appointment, like a history of a carotid bruit, high blood pressure, history of blood pressure not being managed by medication, stress, stroke, history of cancers, neck traumas, etc. Even dizziness and headaches are an indicator. And if we don't communicate that or have a proper evaluation, including imaging, auscultating the carotid arteries, and making sure that your medications are well managed with your primary, there can be issues. So Dr. Anna and myself will make sure that we let you know that if we are concerned based on how you're presenting in our office or based on your thorough personal and family history, we will not be treating that neck area at that time in terms of a traditional chiropractic joint manipulation, which the popular style is called diversified, and that's the snap, crackle, pop. But again, the whole purpose of the joint manipulation is to restore segmental movement. The good thing is our training allows us to do it in other ways if necessary. There is research by a couple of individuals, Cassidy and Church specifically, that is published, talks about the risks of such manipulations. Now, in the world of Google, you can also go and find other articles that indicate different findings. A lot of this is subjective, so if you have concerns, we really want you to speak with us firsthand. Again, you're welcome to call or speak about it during your appointment. The next thing is going to be risks of a sprain and strain, because what that may be is sometimes if too much happens or you've already had an injury kind of starting, it's a wrong place, wrong time scenario. So Dr. Anna and myself will also make sure that we are very thorough in terms of what I call building up tolerance. If you've never been adjusted before, I'm not going to treat you like my 6'3", over 200-pound husband. That's not going to be the case, especially since he's obviously been receiving chiropractic care for as long as I've been a chiropractor. That just won't happen. So we will, again, work up tolerance, give you some alternatives, integrate some soft tissue, because if the tissue itself, the ligaments, the tendons, the muscles, if they're not on our team, restoring some of that joint mobility is just going to be like a yo-yo effect. So you will get the full integration here at our office. Now, benefits are obviously getting you out of pain, restoring joint mobility, being able to do some functional things that you enjoy every day, like going out and mowing, going swimming with your kids. Even just being able to stand for 10 minutes without pain is a goal of ours. Now, in regards to joint manipulation, the alternatives are doing other treatment options. We can refer you to physical therapy. We can get some imaging before. We can send you to a massage therapist. We can actually just have you go to your primary for medication. But our philosophy does say that eventually we want to find the root cause of your pain and maybe not need some medications. We want to be able to restore this healthy and natural lifestyle for you. In regards to acupuncture and dry needling, there are benefits and risks for this as well. One is we're going to ask questions on if you are on blood thinners, specifically Coumadin and warfarin. And if you are, we do ask that you know your last INR, that your primary care should be running every couple weeks or months. And this basically lets us know that with the medication, you're still clotting as you should. If you're on Eliquis or a few others, to some degree that is okay, as well as we will look physically just to see how your bruising is. If you have new bruises every single time we see you, that's a conversation we're going to have with you in your primary if necessary. If you have a history of any heart surgeries or stents, if you have any surgical implants for like a spinal cord stimulator, and a history of blood pressure issues, specifically hypotension, because if you have a history of passing out or syncope, sometimes the theory of getting into our fight or flight and rest and digest mode can really just kind of make you drop. Like, there's some research to support that after chiropractic care, your blood pressure goes down, and that's because you're out of pain. Well, what if your resting blood pressure is already kind of low, we get you out of pain and it goes lower, and it's not enough to provide any blood circulation to your brain, essentially, or extremities? Because eventually what you will do, syncope is basically kind of passing out and reallocating all the necessary oxygen from your heart to your brain, because everything else is just kind of tap out for a minute until it figures it out or recalibrates. Luckily, Dr. Anna and myself are obviously very well aware of the side effects and how to treat and how to prevent any of these circumstances from even evolving. Other things are going to be if you've got clotting disorders, and even if you are concerned and you think you might, or in a history of some reactive platelet issues, great, let's have a conversation. We might order some blood work to confirm that for you. And then other risks can be some minor bleeding every once in a while, because I like to say I'm not Clark Kent, so I can't see through you. We might get a superficial capillary, which a capillary is just where the veins and arteries meet for oxygen exchange, and they're pretty thin. So some bruising, some slight bleeding, sometimes a little pebble-sized clot underneath will happen, and that's just because obviously a little injury occurred and we're trying to heal. After that, it depends on the anatomy. So if we're doing your upper traps, for example, your apex of your lungs is higher than you think. So we will have to distract some tissue to get to the muscle itself. But the big thing is, what's the difference between acupuncture and dry needling? And that varies based on time of treatment, depth of needle, and location of needle. So that's another conversation we can have. But we want you to know that obviously each one's going to have some supervision to make sure that you are safe while you are resting during the process. The risks are a little bit more variable too. If your muscles are so tight and we can't get the needle in or out, that's an issue. There's only been a few incidences reported that I'm aware of. But again, we will try to do other modalities if that is not a appropriate treatment for you. Last is going to be the benefits of needling. So I have seen so many amazing results for back pain and headaches, and even back pain that they didn't realize the needling helped with their digestion. So it's limitless in terms of the benefits here, but some soreness, and again, if you have some relative contraindications, those are risks that we need to monitor, but the benefits really are limitless with needling. More often than not, controlling that spasm, getting that trigger point out, restoring your chi, all of that is going to be so beneficial that it's been used for hundreds of years. We just have to make sure that your screening process is appropriate and that you're safe for that. In terms of anything else, some of the modalities we use, like physiotherapy, instrument-assisted techniques, even this is what's considered instrument-assisted adjustments. Again, benefits, risks, and alternatives. Each one specifically, before we do them with you, we will talk with you about what it does, why we want to do it, and if you're okay with it. If you have any further questions, please don't hesitate to call our office at 913-745-4036. Thank you.